Hi, my name is Jody. Jody Killily. This is for Unit 1, Journal 1. Describe your experience with clinical and mental health throughout your program. Well, I did work at the ER for a long time, so I don't feel like this is a new area for me, but as a prescriber, it definitely is. I think that is my experience through clinical. I've had some great preceptors, they've taught me a lot, and I feel like I'm actually ready to step out and be a PMHNP. So I feel like my experience has been very positive and pretty good a couple of times. I've had some good preceptors. I didn't have the best preceptor in the beginning. When we did the therapy part, when we had to be with therapists, they didn't understand what we were doing. So honestly, that experience was not fun. She almost failed me because she said I didn't do some of the things that were in, I guess, the rubric, the grading rubric. So instead of like passing me, she just gave me almost all F's because she said I didn't do any of those things. So I think that was very challenging because she didn't understand my role. And, you know, as a PMHNP, I know that some people do therapy, but I felt like the roles between us and therapists are very different. I do think that we can absolutely be therapists and PMHNPs at the same time, but if the preceptor doesn't understand, you know, what we do and what our role is, it was kind of, that was challenging, but the other preceptors have been amazing. So I think that was the most challenging part, but I've had such a good time ever since then. And then I chose this population because I feel like they really have a huge need, even in primary care. When I'm checking in patients and they have issues with mental health, they don't want to talk about it and they don't want to admit that they have mental health issues. And until I'm like, okay, you know, I only have one more semester left. I'm going to be a psych NP. And I explain that to them and I'm like, you know, it is completely okay to feel this way, and especially moms in their 30s when they just have a baby and they have maybe postpartum depression. I feel like I was at that point once in my life, and people don't understand how you feel as a mom or even as a dad that stays home. Like I had a dad recently that stays home. And I feel like the reason why I chose that is because a lot of people don't understand mental health, and it's such a stigma to have mental health issues. Even now, you know, you see people and they're on different medications, and people automatically make an assumption about them. So I do feel like it is a part of the population that really needs care and deserves it, just like anything else, just like a cold, just like a sore throat, just like anything. So definitely solidified. I've had a lot of mental health issues in family practice that I've been able to really work through with them. And I'm really excited when they come back and tell me I'm better. I feel so much better. Thank you so much for sitting with me and talking to me about this. So definitely solidified. Concerns that I have regarding this clinical course. That was the one concern I had. I don't think that therapists and PMHNPs should work together. I think that maybe during the clinical, you should work with a PMHNP the whole time. And if they do therapy, then I think that's great. Maybe they learn from someone else, but the therapist part for me was really hard. It was hard to get hours in because there was other therapists and they were trying to get hours in and I was trying to get hours in, and sitting with a patient for an hour, it takes an hour. I mean, let's just be honest. You know, your patients take an hour in the therapy, and there was just, it was just wasn't, I don't think that's a good idea. I think there should be maybe a psychiatrist that should be required, but maybe not a therapist. My professional goals would be to definitely have more understanding of some of the testing that needs to be done. I am not sure sometimes when I have a patient and they I think maybe have bipolar or they have really bad depression, or I'm not sure which test to give them. So I think that's what I'm going to try to really hone in on this semester. Okay, what test did you give them, and why did you choose this? So I think that's the big one for me. So that's my academic goal. My goal is definitely to finish and graduate and have this under my belt, because I feel like it's taken me a little bit longer than it did when I was a family nurse practitioner. I went all the way through, I finished, I took my tests, I became one. This one, I feel like it's taken a little bit longer, just because I'm already an NP, and it takes a lot of time and a lot of, resources to get your clinicals done. So when you're already in clinical and then you have to do more clinicals, it's a lot. So I feel like just being done and getting this over with, that's my goal. Strengths and weaknesses. I feel like my strength is definitely my psych patients. My weakness is when a patient doesn't want to talk. I don't know how to get them to talk sometimes. That's probably a big weakness. And I'm just like, well, why don't you want to talk about it? And maybe coming at it from a different space. Okay, well, tell me something that happened in your day, and tell me something that you're thinking. Are you thinking of hurting yourself? Instead of, well, I don't understand why you don't want to talk about this. So I think that is a weakness of mine that I'm definitely working on. Strength is I really feel like my psych patients are doing so well. So, and my other patients are too. But I really like the fact that my patients in my psych realm, if I have them for family practice, they're doing really well. So I think that's a very good strength of mine. And that's it. So I think that's everything for the assignment. Have a good night.